Hi, welcome to our PowerPoint discussing wearable health technology. In this PowerPoint, we will discuss the continuous glucose monitor known as a Dexcom. We will also cover how to use the wearable technology and use the data it gathers, how it helps to promote and better a patient's health, how a patient uses the device, and the pros and cons of the device in a healthcare setting.
A continuous glucose monitor uses a small sensor inserted just beneath the skin to measure glucose levels in the interstitial fluid continuously throughout the day and night. CGM systems consist of three main components: a sensor that detects glucose levels, a transmitter that sends the data wirelessly, and a receiver or compatible device that displays real-time glucose readings and trends. Dexcom is a continuous glucose monitoring device that has been cleared by the U.S. Food and Drug Administration and is designed to improve diabetes management. To use a Dexcom, a small sensor wire is inserted just beneath the skin and secured with an adhesive patch. The sensor continuously measures glucose levels in the interstitial fluid that can be worn up to 10 days. A transmitter attaches to the sensor and wirelessly sends glucose data to a compatible smart device, allowing users to monitor glucose levels in real time. Continuous glucose monitoring has been shown to improve glycemic control, including reductions in hemoglobin A1C levels. It also decreases the incidence of dangerous glucose fluctuations by providing real-time alerts for hypo and hyperglycemia. By allowing patients to consistently monitor their glucose levels and understand trends in their health data, continuous glucose monitoring supports informed self-management and promotes overall health management in individuals with diabetes.
Managing diabetes is a full-time job, often requiring multiple finger sticks per day. Continuous glucose monitoring sensors like Dexcom can help diabetic patients by giving them continuous blood glucose readings and eliminating the need for numerous daily finger sticks. The results are viewed through the Dexcom app on their phone. The need for fewer finger sticks also improves patient compliance with monitoring their blood sugars. A quote from the American Diabetes Association webpage, diabetes.org, says, "People with type 1 and type 2 diabetes who use a CGM have fewer instances of hypoglycemia and a lower A1C." Having readily available glucose readings allows the wearer of the CGM to treat highs and lows and gives them better control over their numbers. They are able to see exactly how certain foods or activities affect their blood glucose. Having tighter control on their blood glucose helps to lower their A1C. Patients can share the glucose readings with up to 10 people, including their physician. The physician can then make informed decisions about their treatment plan and adjust medications accordingly.
Continuous glucose monitors, such as the Dexcom, are beneficial in diabetes management because you can see real-time glucose readings without frequent finger sticks. This helps users and their doctors make well-informed treatment decisions while tracking their sugars, analyzing trends, reducing highs and lows, and overall improving a patient's quality of life. To apply a Dexcom, choose a sensor site. The Dexcom can be worn on the back of the arm, abdomen, or upper buttocks in an area with enough fat to avoid muscle that won't be frequently bumped. To apply the sensor, wash your hands and clean the selected site. Remove the cap on the applicator. Press the applicator to the selected site until the clear safety guard is flush against the skin. Push the button and remove the applicator. Press on the sensor for 10 seconds and then rub around the patch 3 times. Apply the over patch around the sensor to keep it adhered. Then repeat and rub the over patch boundaries 3 more times to adhere to the skin. The standard Dexcom G7 sensor lasts 10 days, and the newest version can last up to 15 days.
Continuous glucose monitoring is improving safety in healthcare management by providing an early warning system so that patients who use them can detect whether their blood glucose levels are trending down and acting quickly to prevent hypoglycemia. The benefits of having continuous glucose monitoring also shows the trends of how blood glucose tends to fluctuate throughout the day depending on activity. These trends and results reduce hospital admissions by preventing patients going into TKA, which requires ICU admissions. Outpatient care increases engagement and better management from healthcare providers to manage diabetes. There are pros and cons of having continuous blood glucose system. Pros include obviously real-time glucose results for better management. Fewer finger sticks can be burdensome, especially those who check their blood sugars often in a single day. With real-time blood glucose monitoring, there is better blood glucose control. Cons can include cost. Continuous glucose monitoring can cost thousands of dollars per year, and insurance can depend on whether patients are eligible or not. Continuous glucose monitoring systems need to be replaced from time to time and need to be calibrated, and if patients don't, it tends to be not accurate and would require finger sticks. Another con can include patient's skin, which can cause irritations and damage, which can also lead into infection.
How can we as nurses implement the use of continuous glucose monitoring? Nurses are educators, and as educators, nurses provide information, knowledge, and health literacy skills essential for achieving optimal health outcomes. While a patient is under our care, it is our responsibility to provide necessary education, whether that be by verbal descriptions, use of diagrams, videos, or demonstrations, or by any means to provide the patient knowledge needed for the patient to make informed decisions about their blood sugar control. Nurses can implement evidence-based interventions such as self-regulation, education, and integrate technologies like CGM into patient care. As you can see on the slide, there is a picture of the process of self-regulation education in diabetes management. Here we can see 3 steps: self-monitoring, self-judgment, and self-reaction. For self-monitoring, the patient will review their diet, exercise, medication, and tracking of their blood glucose. After that, they can do the self-judgment portion, which, as you can see here, they see the influence of their diet choices, how it affects their blood sugar, and what changes they can make in order to fix their blood sugar. And for the self-reaction portion, the patient can make appropriate changes, adapt to healthier lifestyles, and do things to help sustain those changes. For a patient to manage their diabetes better for optimal health, a strong educational program that focuses on the use of CGM would be a great way to start. Education and implementation can take place in person or virtually with a patient. CGM is often initiated at or soon after diagnosis as part of the initial diabetes education process. Clinical implementation of this technology can be initiated and led by diabetes care and education specialists or clinicians. Some topics that can be reviewed during these in-person and virtual visits include skincare, placing and removing CGM, connecting the sensor to the phone or the device connecting to a clinical account, or sharing data with care partners. There may be patients that are unaware of what CGM really is and could have been given a broad description of it, which doesn't really help the patient understand how great of a device this can be. In this day and age, we have technology that can help our patients take more control of their health, and CGM is one of them. And by the free online resources and education that we can provide, this can help implement this device into our patients' care. On this slide, I have attached a YouTube video that is less than 4 minutes that describes what Dexcom is, which is a user-friendly way to describe what Dexcom is, how to attach it, and any other care that comes along with it. In conclusion, the role that nursing plays in the implementation and adoption of this technology is by educating our patients on what the technology is and the benefits that come along with it.